audience, my cousin, my brother, my girlfriend. Well, hello everyone. I'm here today to inform you about a detrimental disease known to many people here. This disease has three common forms. The name of this disease is diabetes. Like I said, diabetes has three most common forms. The first form of diabetes is called type 1 diabetes. Type 1, a person acquires when they're born. They come into the world with this disease. Type 1, there's no curing it. Type 1, you have to take insulin to keep it under control. The second most common is type 2 diabetes. Type 2 diabetes grows on you as you grow in life. Type 2 diabetes, it occurs because of unhealthy eating habits, lack of physical activity, overweightness, and things like that. Type 2 diabetes, once again, is acquired. You're not born with it. The third most common type is called gestational diabetes. That's known in pregnant women. They get that form of diabetes while being pregnant or after being pregnant. Once again, that's gestational diabetes. I'm sure you've heard of people in your family talking about checking their blood sugar, taking their insulin, going to the doctor to get their blood glucose taken, checked out. These are some of the instruments they use. This is a blood sugar meter. These are the tabs that they use to suck in the blood. And these are the stickers that they use to draw the blood. These needles contain insulin that patients use to inject into their cells to control diabetes, type 1 most commonly. My personal affiliates as far as diabetes, I acquired diabetes when I was 13 years old. I was in middle school and the doctors told me that I've acquired diabetes due to my weight, my height. I was just an overweight individual. I was 13 weighing 230 pounds and I acquired diabetes. That's what they told me I had. Diabetes is very common on my side of the family, paternal side mainly, my father's side. We have a lot of health problems on that side, but that's mainly where it comes from. I have the type that can be controlled. I have the type, if you go to work and you exercise and you eat healthy, that you can control. That's type 2 diabetes. Like I said, if you eat healthy, more of the green type of foods, and stay away from the fast foods, the fries, the drinks, the pancakes with syrup and all things like that. Go towards the green foods and stay healthy, and you get your exercise in, you can help prevent gaining type 2 diabetes, or you can help keep it under control if you incorporate these into your daily habits. And that's what I did. And I started to control my type 2 diabetes to a point to where the doctor told me I may not even have the disease anymore. If you don't control these diseases, these are a few of the things that can happen. If you see the feet or foot on these patients, notice all of the markings and the hemorrhages and the holes in their feet. These patients have no feeling in their feet. They can get a tack in their foot and not even know it. That's place on their foot where the tack entered can become infected or anything like that, and they never know it for weeks at a time. And there comes a time where they have to get their foot amputated. They have to get fingers amputated because they lost feeling. They don't know what's going on until they go to the doctor, and the doctor actually tell them, hey ma'am, you don't have any blood circulating to that limb. We have to cut it off. So if you exercise, you incorporate these things into your daily habits, you can reduce the risk of things like this happening. I did it. Though there are times where I still struggle today as far as getting exercise, as far as eating healthy. It's very hard, don't get me wrong, but it is very possible. These are just a few things that I know about my disease, once again called diabetes. If you incorporate these healthy eating habits into your daily activities, these exercises into your daily activities, you can help prevent gaining diabetes, or you can help keep it under control. Guys, I'd like to thank you for tuning in with me today. I hope you learned something out of this video. Y'all have a great day.